Hello and welcome to the launch of the Greater Manchester Respectful Research Charter. I'm Emily Howlett and I'm a partnership specialist at Vocal, which is an organisation based in Greater Manchester that aims to bring people and health research together for everyone's benefit. I'm also the programme manager for the Greater Manchester Research Engagement Network, or GMREN, and I'm here today with my wonderful colleagues from the GMREN programme. So before we get started today, we've got just a few quick housekeeping items. So today's session is being recorded, so turn your cameras off if you prefer. Please type your questions into the chat box at any time. We do have a Q&A at the end. Everyone's microphones are off by default, so you don't need to worry about any background noise, and any resources, links and QR codes that we mentioned today will be available afterwards. So thank you for joining us today. By way of a very brief introduction, we've co-created this charter because inclusive research is not optional, it's essential, and because the people who experience the greatest inequalities are often the ones that are least included in research. And we know that organisational, cultural and institutional barriers get in the way of developing those trusted relationships, and it's those that we need to change. And we also know that when research teams and community organisations engage equitably, research becomes relevant, more accessible and more respectful, and it shifts that balance. So respectful research partnerships ensure that research is done with communities and not to them, so that it reflects their priorities, respects expertise and produces research results that actually have an impact. So this is a charter today that we're going to be introducing for Greater Manchester that empowers its communities to engage with research on their terms, and it supports researchers with a clear framework for building on these partnerships. So we'll be hearing today from a number of community voices in all of these webinars who can tell you about the Charter and how it's already making a difference to their work and how they're embedding it into practice. And we'll also be inviting you to sign up to the Charter and think about how it applies to you in your work to make research that works for everyone and to build partnerships that are grounded in respect, trust and mutual benefit. So now I'm going to hand over to Charles Quacko-Doy, who is the CEO for the Caribbean African Health Network and our GMREN community partner.
Organization in 3-4 years time you have another opportunity and they're not there, and it's because the lack of understanding isn't there. And also, explaining what research is all about sometimes hasn't happened very well in the manner that people get. So those relationships have been short term and very transactional without long term. In the past, VCFSE organization have been seen more as a route, to get some intelligence rather than, partnering up. And then, whenever we support via focus groups, if we're lucky to, then it's by and not really even disseminating the findings from that. And the expertise we come along with has not always been valued as, really important and at the core of what needs to happen. Next slide, please. So we've been on a journey in Greater Manchester where we absolutely delighted and excited and always pushing ourselves to do things differently. And for some who may be doing stuff in the health and social care landscape, with the current government, there are the three shifts that, mainly reference in various high-level discussions and plans. So we also, through this respectful charter, we want there to be shifts. So we want it to move from a scattergun to more something that's coordinated, joined up, and working alongside communities in a respectful manner. We want to move away from the model of extracting information and intelligence to something that's mutually beneficial. And there are some lived experience on the call, and some of the colleagues in academia that we've worked with that have been on a journey themselves. We want to move away from being just participants to being partners with expertise. And it may be lived experience, learned experience, access into those underserved communities because there's no hard to reach community. We want to move away and a shift from where our capacity, intelligence, insight is ignored to being recognized in that. And I know usually in those publications, you need those with the high level titles and all that, but just simple recognition, acknowledgement, in itself is important. But then also when you planning your bids, thinking through some of the resource constraints we have. And finally, we want to shift from just one of, oh, successful with this 500,000, £5 million, project, and so we need partners. We want to move away from that to something long-term, trusted relationships where communities can also co-own what you're doing. So, if the charter and those who sign up to, if it's implemented, it means there are clear expectations and standards that, our sector can point to. It provides a framework. It can be used for negotiation. So there's nothing box standard, nothing set in stone. And then also that recognition, of the leadership and, the wider networks that we come along with. I think probably the final slide. Yes. So hopefully by the end of today, we need you to start from where you are, whether you high up or bottom up is a call to action. So for our researchers and those who've joined from private firms, wanting to do well, we want you to reflect on what, your previous relationship with voluntary community-based social enterprise organizations has been. If it's been extractive, then please move away from that. Remember the shift. If it's been ad hoc, then move away from that. We want you to commit to signing up to the charter because, we're stronger together. We need to hold each other to account. You can't keep marking your homework. So the charter provides that framework. And please reference it. Make sure it's embedded when you're submitting bids. We're absolutely delighted that NIHR now is very clear on the role of communities and, the voice from those who this whole thing is being done for. And we want you, after you've reflected and committed, to act and make sure you involve in us as VCFSE organizations very early on to shape those ideas and make sure you give us a decent slice of the cake because we would really value that. And sometimes it goes a long way. And also, there's a final bit around how you share decision making power. So historically, sometimes it's yes, you have the evidence base as academics and you want to do something, but also find out from those VCFSE, those communities you're working with, what really matters to them and what are some of those in quote wicked issues. So for us as VCFSE organizations and community leaders, we hoping all of us will get behind and use the charter as a negotiating tool, thinking through those principles and how we can meet them. And also an encouragement that we clear on our priorities. Yes, we're brilliant and we want to carry on and doing things, but we know as a sector we can't save the world alone and we need to join things up. And so colleagues, it's great to see you all on this first webinar, and we hope you can join, this movement and help shape what respectful charter or research and engagement, what it looks like, not just across Greater Manchester, because sometimes we have other, HEIs and universities from out of, Greater Manchester coming in to do some work. And we're not saying the gates are shut to you, but as you come in, please sign up and abide by those principles. Thank you. I'll hand over back to Emily.
Thank you. And now, pleasure to introduce Dr. G or Dr. Gertrude Wafula.
Thank you so much, Emily, and thank you, Charles, for that wonderful presentation. I come in as a woman or from the community, maybe a community crier. I'm setting up to say the voice from the community is going to be the voice that we hold as we go forward and working together. So I want to share with you how we went about actually this process. It has been nurtured over time. We looked at different communities, migrants, refugees. We looked at different people with different conditions. We engaged people who are paid and unpaid. We looked at LGBT plus community. We engaged different levels through surveys. We went to individual consultation, just even 3 questions about how people really engage in research and what they think about research. We did meetings, focus groups, and this is not just a story about numbers. It's a story about human beings and human touch. When you finish a session and somebody says, "Thank you so much," hugs you and says, "I am 40 years, and for the first time, somebody has talked to me about research." It's just more than the numbers. So we have looked at different elements, but also engaging leaders, different seminars with researchers. So what we give you is a collaboration, a co-production with the community and the people from different areas of research. Next slide, please. So we have been listening, but initially we engaged in Greater Manchester, but different areas. You can see the heat map here. It has actually spread more than that, but you can see where you have been over time trying to get everybody's voice, bring on board. So what we bring to you now today is what has been over time, building and getting from the grassroots. Next slide, please. So as we walked around, we looked at how communities were thinking. But we want to say we had. And through the hearing is what we have produced today. And we're looking at how do we actually build this trust? How do we use community connectors? We know that knowledge of researchers, there's a lot of knowledge from that field, but down the cooking pot is in the community. And the community connectors are those ingredients that make this happen. So we have seen what they can actually bring to board. But we also got to know there are various barriers that are really hindering this partnership. And some of them range from just skills in research, issues around resources, access to information, not understanding the funding system, again, people having no network, not knowing what's happening, and of course, lack of trust, and too much of academia and complex issues like Charles has spoken about. So we have tried to unpack this and come up with something that will enable us move in a way that carries everybody, connects everybody, and we move together as a community of researchers and experts as one journey co-produce. Next slide, please. So as we go ahead, we are looking at issues. Poor communication has been there. What can we do as we do that? And communication should start from the grass, from the time you get the proposal, even before then. It should not just be, just like one time that you're in and you're out. That has really been happening. We have been extracting. We only go and take when it really matters to us. This has to change. And Chair has said the shift is there. And this charter gives us that shift. We need to continue connecting the community, building sustainability, and holding hands as we go by. We learn from them as the expert in the community. We bring that knowledge together and work as one. So this has really been a journey where we say the community is ready to hold our hands. We just need to be there, open, and try to address some of the barriers I've really talked about. Next slide, please. So I just want to summarize to say this, we're not just human stories, but we also believe in numbers. So we went ahead, we have at least made 205 organizations. We have reached voices from different organizations, almost 215, had different workshops. We went outreach into research, sending out questionnaires, but we also had participants just coming, engaging with us in different scenarios, sometimes even in markets, sometimes where there are workshops where we just had to tap in what people are really doing. So these numbers speak, but I don't want you guys to forget the human story about the needs of the community as we go through this charter. And the last slide, please, if you allow me, go on the last slide. And my message would be, having gone through this process, engagement process is embedded in trust. And this has to be as equal partners. For it to work, it has to be nurtured all through. We need to set clear expectations as we work across the communities when we're working. And we have to do this with mutual respect. And you see the charter respecting that. We need to set goals that actually benefits all. Maybe not equal terms, but with respect. Above all, we need dynamism and need to be responsive in the way we communicate, but also the way we address real community needs. We need to look at what is really what the community need than what research need. If we can have the balance in that, then we are better off. And with this charter, it sets us to move that direction. So colleagues, sign up and let's have this document become a live, living tool that actually connects us, and not only connects our mind, but our thinking and how we influence the community on the ground. Thank you so much for listening. I pass you over to Joanne, I think. Thank you so much.
I've really enjoyed the Made by Mortals examples and walking in other people's shoes and hearing and imagining what it's like. It really helps put you in focus for putting yourself in somebody else's shoes, which is really at the heart of a lot of what we're talking about today. So I've really enjoyed that part of it so far.
Well, it's this amazing experience. It's the first time I'm here, and I'm super excited about how we can embed research into our community outreach programs, because in the end, reaching the communities where they are is important for research. And you know, involving them is a good thing, because so far research has been some kind of brought in from the outside, like it was said earlier, parachuted in. And I really like the change and attitude and this paradigm shift that research comes from the inside out. And I'm very excited about this development so far, and I'm really looking forward to the discussion later on.
My name's Juliet, and I'm from North Manchester. I'm involved in the community work that takes place between Cheetham Hill and Crumpsall area. I've been invited today, and I'm glad that I came. At first, I just thought, what was this all going to be all about? Because I didn't really read too much into the information. But I think the key point for me here, it really is around research and what researchers intend to do to make a change, to make a difference. And so that's where I'm really interested to see what's going to come out of this around that area. I think too often community groups, individuals have been used in research and they get nothing back. So I think it's, from what I can see on the pillars, and I'm going to look at it a little bit more, it's going to be quite interesting and exciting to see the work that comes out of that.
Accessible for everybody and understandable, yeah, so sort of tailored, yeah. Because do they say, is it like there's over 200 languages?
Yeah, not only for the organizations that these researchers are going to be collaborating with based on their level of understanding of research, but also it's
actually make sure you're actually doing it for the benefit of communities, because people make assumptions about what's important at the moment in time. So yeah, so I'll shut up now.
It's slightly different. We may end up having that and they don't help. Because to me, where people are operating organization or the general country legal framework with the laws and what.
And I work for an organization called Awakening Minds. We're based in Rochdale, and we deal with mental health in the Asian community, South Asian community. I came here today. I wasn't really expecting what I got, let's just put it that way. It has been informative, it's been good, it's been a learning experience, and I've thoroughly enjoyed myself. I've enjoyed giving my opinion, I've enjoyed being listened to, and overall I've just enjoyed it all.
My name's Simon, I'm from Manchester Cancer Research Centre. We're here today listening about the new pillars that have been implemented across Greater Manchester. Very interested to see the work of that and all the community organisations here. And yeah.
It's been a really good day so far, very interesting and really useful to think how we can take forward this agenda and embed it in our work. So thanks for having me.
Thank you so much. Today is to me, is a very exciting day that we have come to appreciate and get to interact with the people from the communities and interact with the actual researchers from the VCCS sector and within the academia. It is important for us to come and have such forums and benefit from getting to understand each other beyond just meeting at points of collecting data and things like that. And when we get to a point where we are putting together policies that are going to guide us, this particular point is important for us as people who come to this, and especially when it comes to understanding the people who always respond to these studies, what they go through, and understanding the researchers, what do they go through, pressures from funders and issues of timelines, they also need to be understood in that way. So it is beneficial for us to be in such a forum today that we get this. Thank you so much. I'm John Alex Muita. I'm a public community involvement and engagement member within the NIHR. Thank you.
You, Joanna. That was we wanted to share that video. Apologies, it might have been a little bit stuttery, but I think it was just important to really see the kind of level of engagement that we've had regarding what's in this charter. A lot of very, very different voices, and it was a really inspiring week that we came together with those videos are from, really to listen and learn from some real key individual community members. So that was why we wanted to share that with you today. My name's Sue Woods. I am head of operations for the Applied Research Collaboration, which is one of the many research infrastructures in Greater Manchester. But I am here representing many of my colleagues who we've been working together on this research engagement network. So as you have heard, through our listening activities, we've worked closely with communities to co-create the Greater Manchester Respectful Research Charter. This charter is more than a document. It represents a shared commitment to building trusted, impactful, and mutually beneficial relationships between the voluntary community and social faith and social enterprise sector, communities of Greater Manchester, members of the public, researchers and research organisations. It is not a static checklist, as Charles has already alluded to. It is intended to inspire inclusive research and ensure everyone has access to opportunities. Importantly, it's about empowering community organisations, community leaders, and the public to know what to expect. What does good look like? How should inclusive research take place? At its heart is a very simple but powerful belief. Everyone has the right to have a voice in shaping health and care research that improves health and well-being for everyone. Today, I'm going to introduce you principles of the Charter, but this is just the beginning, as you have already heard from everybody else. We encourage you to join the other webinars, and where you will hear inspiring examples of these principles in action and see the real impact of partnerships that make research inclusive and meaningful. And as I talk through these pillars, please don't be sitting there going, but that's really difficult, that's really hard, we've done it like that for so long, how do we change what we do? Just think about, how can I as an individual, how can I as a research team, how can I as a research organisation or a voluntary sector organisation do things differently to make those step changes that we need to hear? You know, people in those meetings, those workshops that we held said, we have been talking about this for too long now. We need action. We need to see things change. And this is really why we have put this together, to inspire those step changes that we need to make. So pillar one is about community leadership. And we heard about the importance of this from Charles. Doing meaningful research that matters most to the people it is about and for. When we talk about community-based research, it's about more than just involvement. It's about building those ongoing partnerships that make research meaningful and driven by real community needs. First, we have to take time to understand before we even start to talk about research and research projects and what needs to, what participants I need and those kind of things. It means partnerships with community organisations and groups who can help connect and listen. We need to work to align research priorities with lived experiences and those greatest need. Power dynamics really matter. We have to acknowledge and address the imbalance between researchers and communities, especially those from vulnerable and marginalised groups who have not had the opportunity to take part before. Active involvement is key. Communities help shape research questions, study, designs, implementation, and interpretation of results, and findings need to be shared more widely. In short, we do research in ways people say are important to them. We need to set clear expectations together. And we go further, inviting communities into leadership, into governance, decision-making, whilst tackling those barriers that keep people out. This isn't a one-off. We create mechanisms for feedback and long-term partnerships that adapt as needs change. We invest in community organisations with expertise to lead, and we make sure those who have been missing from the conversation get the support that they need to take part. In Pillar 2, we talk about respect for community values, listening and learning first to understand people and their needs. When we talk about respectful research, culture, religious competence, racial sensitivity are absolutely essential. The first step, listen and learn. Curiosity done respectfully builds trust. We know respect for cultural norms, traditions, and values throughout the research process. We need to show that. That means involving trusted voices, community champions, leaders, lived experience experts right from the start. Before research begins, we work together to create shared aims and set clear expectations. Language matters too, so we provide translation services, materials in preferred languages and accessible formats. Researchers receive cultural competence training and acknowledge past mistakes to rebuild trust. And we never forget that identity is complex. People belong to many communities and have unique experiences of discrimination and oppression. In Pillar 3, we look at embedding research in communities, developing those long-term relationships between researchers and communities, fostering trust and collaboration for future projects. So not just turning up when we think we need something, being there in between those projects. It isn't just about one project, it's about creating those long-term relationships that foster trust and mutual benefit. That means an ongoing dialogue, honest and transparent communication, and feedback loops that keep communities involved. We know that historical experiences can create barriers, so open conversations are essential to bridge that gap. We also need to invest in people, community champions, embedded peer researchers, recognising their expertise and rewarding their time as equal partners in research teams. And the same goes for voluntary community faith social enterprise organisations. They play an absolute vital role in connecting to communities with the greatest need, and they deserve recognition and resources. We also value community assets, funding venues for discussions, supporting local spaces, making research accessible in the places where people live and feel comfortable. Finally, we take a coordinated approach across research teams to avoid overwhelming some communities while leaving others behind. It's about balance, respect, and partnerships that last well beyond any single project. Pillar 4 is about accessible approaches. Community involvement opportunities should be accessible to all. Clear, accessible communication is at the heart of respectful research. People need information about taking part in health and care research that is easy to understand and is delivered at the right time. We start by exploring language and communication needs early, making sure resources are in place to meet them. That means avoiding jargon and acronyms and creating partnerships with people who can translate messages into culturally appropriate ways. We agree up front on how language is used to avoid confusion or offence, and we make sure venues and meeting spaces are accessible for everyone, considering mobility, hearing, sight, and other sensory needs. Meeting times and formats are agreed together, and we stay flexible because what works for one group may not work for another. Digital exclusion is real. We cannot rely on online methods alone for all our communication. We need to provide safe spaces for sensitive conversations and prioritise well-being, offering support where trauma might arise. And we use creative, fun approaches to break down those barriers and encourage active involvement. Communication isn't just about words. It's about creating an environment where everyone feels informed, included, and safe. And finally, but I think the most important of these pillars is the mutual beneficial relationships, working together in a way that rewards and values contributions, building mutually respectful and productive relationships. True partnerships and research are built on equality. Everybody's role is valued and respected. Reciprocity is at the heart of this, ensuring mutual benefit for both communities and researchers. Recognition matters. That means timely reimbursement for individuals and community organisations and building reward and recognition into funding bids. Appreciation and thanks should be part of everything that we do. Feedback is essential too, not just telling communities what happened, but showing the difference that their involvement has made. And we collect feedback to keep improving how we work together. We share feedback and learning to build confidence and create sustainable outcomes. We build equal and respectful partnerships. So join us on this journey. This is not the end of this conversation. This is very much the beginning of this conversation. We need to shape how we do this. We need to be the change that needs to happen. So I'm going to stop there. Thank you. So the charter is available from this link. If you have a QR code, if not, don't worry. The slides that will be shared with you. This is temporarily the home. The Respectful Research Charter and the Research Engagement Network will have its own website in the new year, thanks to the team that are currently creating that. And that will be a space where we can all share our examples of how we do this together. Next slide, Joanna. So if you have access to Mentimeter or a phone or the link in the chat, there are just a few questions on here that we would just like you just to take a minute to fill in, if that's okay. And then we will go through the responses. And then we will go to some questions which Emily has hopefully been collecting as we have been going. So I'm not sure what happens next. Do you want to do sharing this?
I think, Natasha, if you're available or wise just to pop the link back in the chat, that'd be great.
There it is. So the first question is, where are you from? So if you could share with us, and hopefully some magic will happen and we will hear lots of bar charts coming up here. Just give that a few minutes there. And I think the important thing about this is this is a session to introduce the Charter. This is not our main route of engaging with voluntary sector organisations and community partners, but it's actually really good to see so many people from research organisations here today, because we all need to be part of this change, and I think we have responsibility to shift that. So a really good mix of people here today, which is great to see. We could just move on to the next question if everybody's had a chance to do that. There was an opt-out clause here where you say all of them. So it's taking you a little bit just to think about, for you, what do you think is the most important one of those pillars? What is it that speaks most to you as really needing to be kind of put into practice? It's not to say that not all of these are really important. So a bit looking at here for really embedding research in communities. I mean, that comes without a doubt with community leadership. So those two are really closely aligned, and mutual beneficial partnerships is really up there, and I'm glad you all agreed with me. And then the final question is just to have a think about. I'll give you a few minutes to have a think about this, and I'm putting some responses. You don't need to write an essay, just a couple of words would be great, just to think about what's one thing you as an individual or you within your organisation can do starting today. Let's not wait till tomorrow to start to put Charter into practice. What's one take-home message that you could really kind of commit to actioning? So we've got team buy-in. So going back and sharing this recording is available for others to watch. So do share it. Sharing information about the Charter, building long-term relationships, reviewing funding bids. That's really important. Sharing it. That's all sounds great. Asking communities for feedback, greater awareness, closer community links and relationships. That's fantastic. So everybody's going to go away and share this with their colleagues, which I think is great. And as I said, if we could share the links to the future webinars, let's get more people having a conversation, and then we can have a think about how we can continue these discussions. Oh, that's a good one. You're building it into their PPI strategy for presentation tomorrow. That was fantastic. So that's proper action right there. Start to think about underrepresented communities. That's really important. You know, who are, I think we get comfortable with always going to the same people. You know, I was ringing Charles up, and Charles is great, and we absolutely love Charles and Khan. But there are a lot of other people out there as well who I don't know yet. So it is really important that we start to think about broadening our connections and working together to connect ourselves. Yeah, we cannot do it alone, beautifully said. So this is very much about creating that movement, creating those networks, creating those opportunities to have conversations so that we can do this together. Brilliant. Thank you so much. We will collate all those responses and we will feed them back to you. So that's fantastic. Thank you for that. I'm going to hand you back to Emily, who hopefully now has some questions to pose. And any one of us can respond to that.
Right. So I'm going to come to Jason's question first. He says he's got to go soon, so hopefully he's still here. It says, I'd like your thoughts on how these learnings could be applied to online audiences. Do you want to take that one?
Sorry, Emily, you broke up slightly there. Can you just repeat that?
Sorry. So this is from somebody who's got to leave quite soon. But he just asked, I'd like your thoughts on how these learnings could also be applied to online audiences.
Any other thoughts from anybody?
I can just go on and maybe add on, maybe try to answer that question. I think having a platform we are going to be sharing it online, that's going to be one, so we can signpost people online to see where we are. But if somebody has an occasion where they can invite us to present to online audiences to share what we are really doing in Greater Manchester, and like Charles said, beyond, that would be fantastic. So we hope that we can still get this engagement and get to more people who are beyond where we have here. I'll let maybe Charles or somebody add on. Thank you.
Yeah, so I mean, if I could just chip in, I mean, like the traders mentioned, I suppose it's understanding those needs, although people will be online and they're not physically in that space. It's also about how we take them on the journey, how we make sure, whatever we cascade in or the engagement we have in is meaningful. It's something they get. And then, just like in this day and age, people still build virtual relationships. It's just thinking about that. So those principles can still apply, although it's virtual. It's about how we take people on the journey. So let's say if you need to engage with them over 3 sessions, then how you make sure that is coordinated in between those sessions, checking in and making sure that, what happened in the previous session, they understand, know very well what to look forward to. I think all those things are really, really important.
Right, thank you, Charles. There's actually another question here for you, Charles. It says, so good to remind organisations of establishing sustainable relationships. Why do you think advocate relationships became the standard?
Right. So, thanks for that brilliant question. I think the more, the rationale behind this sustainable relationship is in my work, and other people will attest to it, the biggest barrier we found is a lack of trust. And that trust is stemmed from that extractional, transactional relationship. And so, that hasn't always helped. One of the things I know when we embarked on this journey, probably one or two colleagues, without putting anyone on the spot, is now a trustee for a local charity, which is brilliant, because yes, you can engage groups, you can offer reimbursement as we advocate via the Respectful Charter. But what are those other needs that in kind could really move those organizations forward and get them thinking differently? And those are some of those key things. So, if you are thinking about how those organizations can also, be around for the long term and outlive the founder, it means that when you're long gone from the institution you're part of, those ways of working and the behaviors and the principles and those values would have been embedded because those organizations will be there, and there's something definitely to, look back to.
Okay. Thank you, that's great. There's a question here. Is there a plan to monitor or measure how the Charter is being embedded in research within Greater Manchester, and or try and evaluate the difference it's making?
It's an excellent question, and one that we have given a lot of thought to. That is kind of our next step in terms of socialising the Charter now, getting people familiar with it, getting people using it, so that we can then think about how we do measure the impact. We can't enforce measuring impact, but equally we can, we want people to sign up. When we have our website available, there will be commitments for people to sign up their commitments and kind of almost hold themselves accountable for delivery. So it's going back to those organisations that can be accountable, that can put it in their public involvement strategies, that can embed it into their governance structures and self-monitor what's happening. We would love to do a longer term evaluation. That's probably something we need to think about funding for. And I think there are lots of things we can think about for that. But as I said before, this is just absolutely a start of a conversation. So we really want to start thinking about these things now together. So anybody, any thoughts on that, let us know. Charles.
Yeah, thanks, Sue. So, colleagues, and especially those within the GM system, there is appetite and there is real support for this from NHS Greater Manchester, which is our ICB, from the Greater Manchester Combined Authority, and some of you will know about the Good Employment Charter, and there's an accreditation to it. So, on the back of, the charter and people signing up, and as you reference self-monitoring, we will be creating those opportunities where people can share best practice, where people can also reflect on their own journey as institutions, as networks, as organizations, where they've been and how the charter and the framework has helped them. And then more importantly, around health inequalities, what is the difference your research is making? But I suppose we will think about some metrics, which can include things around how much investment goes into the VCFSE sector, try and find a baseline, like I referenced earlier on about the knowledge transfer, on the back of signing up to the charter. Can you tell us maybe how many, of your, workforce are now on board of trustees or other governance boards of VCFAC sectors? And some of those things can be measured. So it will be soft, but it will be win-win. But more importantly, how we get people to shout out about why they've signed up to this, because it's not mandatory, but it will be encouraged. I think, it's a good thing. And if you look at some of those positive impacts we have in from the Good Employment Charter, then, we want to mirror some of those when it comes to, respectful research engagement.
Great. Thank you. Another one here. This sounds like an appropriately massive endeavour to get buy-in. Is there guidance for other geographies or communities to undertake this process and create their own charter?
We can provide that, and we have a lot of learning, and we have reports on what we have done, and feel free to share throughout the webinar as well. But yes, I think maybe a conversation about what would be helpful might help us to think about how we spread our learning to other areas. Charles.
Yeah, just adding to Sue's point, I think you will know your system or your ecosystem much better. And so what would be really important, the way we've been able to get buy-in, obviously the initial resource from this came via, from NHS England via the ICB, but in Greater Manchester, we have a VCFSE Accord, so easy to hook things on. We have an elected mayor and the combined authority. And so the very senior person responsible for implementation, is endorsing, is supporting. Plus also on our patch, we have 4 universities who are all sold out and bought into this. So I think it's that mapping of your ecosystem. Who are the key stakeholders? Who are the movers and shakers? How, do you get their buy-in is important. And as Sue has mentioned, we're more than happy to support and, share our personal journey and, help you, replicate that over there.
Gertrude, you want to come in?
Wanted to add on what Charles has said there. And I think for individual organizations, when you are writing a proposal and actually citing, you are taking some of those principles in your proposal and you're writing, it gives that confidence for whoever organization that are going to work with you, that actually you're using that as part of your charter. Or just when you're evaluating part of your research, can you take some of those elements and see where are you doing good? Where can you really work differently? And again, share with colleagues that will also be part of the aspect of your engagement with the community. When you go there, we are also using this as a tool to engage with you. I think that will give more also credit to whoever is using the charter to say that is really having an impact. And with that, I think we can be able also to see how can colleagues share that aspect of those work to see what's really working for them, okay, and what aspect can we do to improve, and we continue using that tool as we go by across Greater Manchester and beyond. Thank you.
Great. Thank you, Gertrude. Just looking at time, maybe if we just do one more, and then if there are any that we haven't answered, we will send round answers to those when we send round the other resources. So there's just one here. Does having the charter mean only the mainstream organisations that sign up expect the voluntary sector of Manchester to engage? Might be inflexible, but it's a genuine action towards voluntary partners.
Charles?
Well, yes. As you know, I suppose what's really important, there's a framework. We want it to be a guide. We want it to move, research forward in the right direction. And so that's why we're being very bold, ambitious about it. We want VCFSE partners to reference that when they're having their conversations and discussions. One of the key things over time that we will be pushing for, is within sort of procurement and when people come to do stuff in GM, we would want to get to a place where all the key stakeholders who sign up to this are referencing that in their tendering document. And that could be a massive win in itself. So some of you will know about social value and how some, standard tendering will ask how you're going to ensure that is happening in a meaningful way. So that's where we want to get to. So back to Sue's point, obviously we can't have, a stick coming after anyone, saying you've got to do X, Y, Z. But it's best practice. Lots of talk about health inequality, lots of talk about inclusive research, lots of talk about leveling up and making sure, that no communities, or community is left behind. And I think this provides an excellent framework, for that. More importantly, if we all value what the VCFSE sector does, this could make a real difference in the sector's outlook and sustainability as well. Hence why we will and are pushing, for people to sign it up and reference it and use that in conversations and in developing various partnerships.
Great. Thank you for that. There are a few more questions in the chat that speak to kind of more specific pillars, but I suggest that, sign up to the other webinars, come along, hear about these individual pillars, and then hopefully your questions will be answered there, but it will give you another opportunity to ask them in that forum as well. Great. Sue, hand over to you. And Joanna, are you happy to share?
Joanna, just while Joanna's loading up the slides, I think the point you say, we don't have all the answers. So I think this is very much about how do we create those conversations that we can start to do this in a way that works. So yeah, please join us. I'm just going to hand you over to my lovely colleague Anila. This is another one of the things that we're doing alongside the webinar. This is going to be a bit more interactive. So Anila can share what this one's about if you wanted to sign up to this.
Yeah, just to this is all still part of those discussions that came out with our VCFSE colleagues about kind of having the opportunity to learn from researchers and researchers to be able to learn from communities as well. I think there was a question in the chat from Claire about kind of how do researchers who maybe don't feel confident or nervous or want to develop those skills around the charter. This links to that exactly. So these are 4 workshops. We're looking for 15 researchers from Greater Manchester and 15 voluntary sector people who are leading their community to come together in these 4 workshops to explore the charter, explore what those mutually beneficial relationships look like, all those kind of different pillars, and have this reflective learning space to build those relationships, whether that's an early researcher at the start of a project or whether that's someone that's just wants to develop a new research research community. So this QR code on there, we're doing this in collaboration with Collaborate Out Loud, who have got lots of experience in planning sessions and delivering workshops. There's 4 dates. The first one starts in January. The first one's also in person. Then there's 2 online workshops and then another in-person workshop to be able to have those conversations. And there is some small pots of funding for the VCFSE people to be able to fund some time to attend and be part of this. So follow the QR code. There are some information sessions if you want to ask more questions about this that you can sign up for. I think the first one's tomorrow. So yeah, that's me.
Thank you, Anila. So on the next slide, Joanna, I've forgotten. Oh, just the sign up for the future webinars. Hopefully this has whetted your appetite for some more discussions, and these are the dates for, we will take you through each of the individual pillars. We will have some of our community partners who are living and breathing some of this, and giving you some sort of exemplars of how to make some of these things happen. So do join us, and it would be great to see more people on those follow-up webinars. And back to you, Emily, do you want to?
Yeah, a huge thank you for joining today, and a huge thank you to the whole REN team, everybody that's been involved, and that includes our partners at NHSGM and VCFSE Leadership Group and all of the community organisations that have been involved in the REN to date. Yeah, it's been wonderful, and yeah, look forward to more webinars.
Thank you, everybody. And sign up to be part of research. If you want to be a research participant, here's your sign-ups. Thank you for joining us today.
Thank you. Bye.
Bye.